All right, hello everybody. Welcome to our lesson here, Psychoanalysis, Therapy, and Treatment. So we're going to take a look over the next week or so at some different therapy and treatment types. The first one we're going to look at today is psychoanalysis. So our objectives and standards are to understand elements of psychoanalysis, therapy, and treatment, and to analyze strategies and techniques used in psychoanalysis treatment. And take a moment there to please read the standards if you would. All right. Our desired result: how does psychoanalysis treatment and therapy help people? Some some vocabulary words here. Psychoanalysis. This is a therapy that is aimed at making patients aware of their unconscious motives so that they can gain control over their behavior. Insight is an apparent sudden realization of the solution to a problem. Free association is a method used to examine the unconscious, as the patient is instructed to say whatever comes to his or her mind. Resistance is a reluctance of a patient either to reveal painful feelings or to examine long-standing behavior. Dream analysis, it should be a period at the end of the word there, I just saw that. Dream analysis is a technique used by psychoanalysts to interpret the content of patients' dreams. And transference is a process experienced by the patient of feeling toward an analyst or therapist the way he or she feels or felt toward some other important figure in his or her life. So understanding psychoanalysis. Psychoanalysis was the only form of psychotherapy really practiced in Western society for a long time. When we think of psychoanalysis, we think of that top picture there. We imagine somebody lying down on a couch or on a bed or something like that, talking to a therapist. But there's more to psychoanalysis than just, lying down on a bed or a couch and talking to a therapist or a counselor about your problems or what's going on in your life. There's a little bit more to that, but that's what a lot of people imagine, and it does. Psychoanalysis does have a lot to do with that picture, but we'll explain that a little bit more here. Now, the theories of psychoanalysis are based off of those of Sigmund Freud, that gentleman there in the bottom picture. He believed that psychological disturbances are due to anxiety caused by hidden conflicts among the unconscious of a person's personality. So try to remember, maybe some of you can remember back to the unconscious when we looked at the mind and talked about personality. Freud believed that our mind has the conscious, the ID, the superego, and ego, and in there is contained part of the unconscious, part of the mind that, some of those desires or wants or fears that we don't really talk about a lot. We all have these things that pop up in our head, these desires or fears that pop up. So that's what we're talking about with unconscious. So the goal of psychoanalysis is to help a patient become aware of those things, of those unconscious impulses or desires or fears that can sometimes cause anxiety. If a patient can understand their unconscious motives, they can take a step towards gaining control of their feelings or their behaviors. Finding information with free association. The procedure of psychoanalysis is slow. Okay, it's not a real quick, treatment or therapy option. It's not like you go to a psychiatrist or a counselor, once or twice, and boom, your problems are going to be solved. It takes time, and in some cases it can take years before psychoanalysis really can help a person or a patient make any significant changes. Over time, an analyst, such as a counselor or a psychiatrist, will help the patient through examination of unconscious motives behind their behavior. Typically, an analyst begins the procedure of psychoanalysis by having the patient relax, like we said, lie down on a bed or a couch, become comfortable, and describe anything that comes to their mind. And this is a method that's called free association, just asking the person to kind of just say whatever comes to their mind. They might say, hey, how was your day? And the patient will just talk about their day, and then maybe they talk about their day, and then maybe they talk about their weekend and the time before, and then maybe they talk about what they did, over summer vacation, whatever. And it's just, it allows the patient just kind of just, spurt out information, anything that pops into their mind. Now, a patient may not want to discuss certain items, whether they think that, oh, that's not important, like, yeah, I had a lollipop yesterday afternoon, why is that important? Or maybe it's embarrassing. Maybe it's something that happened to them, or that they're, maybe they got yelled at their boss at work for not doing something and they're embarrassed about that. But they are urged to discuss everything to help the analyst and the patient as well understand their unconscious, what's going on in their mind that's causing this anxiety. Now, the analyst may not say anything for long periods of time. They usually just sit there. They may type notes. They write down things, and sometimes they'll ask certain questions to provoke the patient to investigate their unconscious. They might say, well, how was your dinner last night, or what'd you have for dinner, or even something simple like, how have you been? How's work been? How's your family life been? So just to try to provoke that type of free association. Now, the trouble with resistance. Sometimes a patient, like we said, might be uncomfortable with revealing certain painful feelings or memories, and this is known as resistance. Now, this doesn't always mean that the patient will do this willingly. Sometimes a patient will say, in their mind, I'm not going to talk about what happened to me. I fought with my boyfriend or my girlfriend, or I fought with my mom or dad last night, and it was embarrassing what was said, so I don't want to talk about that. Other times, a person or a patient, may not realize that they're committing resistance. Sometimes we block out painful memories or painful feelings without really thinking about it. Sometimes a person might say, I honestly have nothing to talk about today, or they might be talking and they go, sorry, my mind went blank there for a minute. We all kind of have those moments where we go, what was I talking about? Or what was I doing? Those types of things. So again, it can be willingly or unwillingly that a patient does this. If this occurs, the analyst will simply point out to the patient that they're having some trouble and things like that, and they'll wait for them to continue. Sometimes the analyst might approach another area to resistance, like if they're talking about family and the person begins to show this sign of resistance, maybe they'll say, well, why don't we talk about work, kind of get your mind off something else. Analyzing resistances. This allows the patient and the analyst to understand the source of the anxieties and how the patient deals with them. I put the picture of the kid up there with a test because I know a lot of students, and myself included sometimes, have anxiety about taking a test. We all do at certain points in our lives. So, maybe this counselor or analyst might ask the kid, how was school today? And the kid goes, I don't want to talk about it. And he might say, well, what happened at school that you don't want to talk about? And the kid will say, oh, I had a math test, and I don't like math, and I just don't want to talk about the test, okay? I don't want to talk about it because the test is a source of anxiety, maybe math is a source of anxiety. So this will help the person and the doctor or the counselor know, hey, math tests are a problem of anxiety, and then they can address it. A discovery of dream analysis. Sigmund Freud believed that our dreams, let me fix this real quick, my apologies, believed that our dreams express unconscious thoughts and feelings. So what we dream that we don't think about when we're awake, or things like that, or talk about others when we're awake, are some of our thoughts and feelings. The technique of dream analysis involves the analyst interpreting a patient's dreams to find unconscious thoughts and feelings. According to Freud, dreams have both manifest and latent content. Manifest content is the things you remember about your dream. Maybe you wake up and you go, man, that was a really weird dream. I was on a roller coaster and it was snowing. I don't know, something like that, and there was a guy in a giant mouse suit. I don't know, something like that, sitting next to me on the roller coaster. But then the latent content would be the hidden images or objects that have a symbolic meaning, such as a rainstorm, birthday balloons, things like that. That might be a trigger or a sign of anxiety or something else, such as riding a roller coaster in the snow. We might look at that and say, okay, well, what does the snow represent? It represents cold. It represents winter. So maybe you're upset about winter, or maybe there's something going on in the winter time that you're nervous about, or something like that. Maybe you're nervous about driving in a snowstorm, whatever the case may be. In terms of analyzing dreams, an analyst may determine that certain items might represent concern or stress over a certain topic or event, like I was just saying. Understanding transference. Eventually, the analyst begins to appear in the patient's associations and dreams, such as maybe you see your doctor or the counselor with you in your dream at on the roller coaster or something like that. A patient may begin to feel a certain way towards the analyst as they have towards another important figure in their life. And this is called transference, such as maybe you have a big fear of roller coasters, or maybe you have a big fear of doctors. So maybe you begin to associate your doctor with your physical doctor. Maybe getting a immunization or something like that, and you begin to become very nervous around your counselor because you become very nervous around your doctor when you have an immunization or when you go to the doctor's office. So this can allow the person to experience their true feelings for an important person towards the analyst. So if I'm nervous about going to go see my doctor because I'm afraid of my doctor might tell me I'm sick or I need to get an immunization or something like that, and I associate that with my counselor, I might begin to feel nervous towards my counselor, and my counselor might say, okay, what's going on today? Why are you so nervous and anxious? And you say, oh, I don't know, I had, just feeling very nervous and anxious. And then they will talk about some of those fears they've talked about in the past, about going to doctors or immunizations or things like that. And this allows the patient to focus this back on, how they feel when they see the analyst. And over time, the patient begins to realize their unconscious thoughts or feelings about a certain person and why they feel the way they do. They might say, oh my gosh, I'm nervous about seeing you because I see you in my dreams when I'm going to a doctor in my dreams, and now I realize a lot of my anxiety and stress is from going to the doctor and things like that. All right, so our closure. How does psychoanalysis, treatment, and therapy help people? I'd like you to take a look at the video here at the bottom too. That'll and answer the questions that will respond to that as well. But again, remember, how does psychoanalysis, treatment, and therapy help people? Think about some of the things we talked about: free association, transference, dream analysis. All these things are key to psychoanalysis and helping people get better. All right, I hope you have a great rest of your day or night. Talk to you soon.